A psychological crisis is a type of response to a critical event or series of events. The crisis occurs when usual methods of coping with the critical event have failed, and the person is in enormous distress. A severe disturbance in mood or thinking threatens the person's safety and/or the safety of those around him or her. Crisis intervention teams are a community effort joining both the police and the community for common goals of safety, understanding, and service to people with mental illness and their families. CITs respond to persons in crisis, generally visiting them at their home, though they may contact them at other locations. CIT officers are often called upon to respond to crisis calls that present officers with face-to-face complex issues relating to mental illness. Crisis intervention teams are comprised of nurses, social workers, psychiatrists, psychologists, mental health professionals, addiction specialists, counselors, family therapists, peer counselors, and in some cases, community volunteers and clergy members. CITs provide a range of services including assessment, crisis intervention, counseling, information and referrals, and may coordinate contact with the appropriate community-based mental health services. Also, CITs may help consumers arrange ongoing treatment and may also be part of follow-up procedures. Though CIT referrals most often come through calls to the police department, the goal of crisis intervention teams is not to arrest or imprison their consumers. Rather, the goal is, through the least restrictive means possible, to provide psychiatric and mental health assessment, placement, and care to each consumer. CITs are on call 24 hours a day, 7 days a week. The Portland, Oregon Police Department is apparently unable to fund crisis intervention teams. However, in 2008, 218 police officers had voluntarily become certified in crisis intervention. Due to steady and ample CIT staffing, 98% of all crisis calls are answered by a crisis intervention team within an hour of requesting assistance. In 2007, Cleveland, Ohio's crisis intervention teams serviced 9,047 adults and 1,137 children. Each day, an average of 37 individuals call or are referred to the crisis intervention program. Of these 37 individuals, 10 receive immediate face-to-face intervention and less than 5% continue to the judicial system. Police departments, Medicaid, private donations, NAMI, local universities, and city and/or state mental health boards generally provide funding and training for CIT programs. If you or someone you know is experiencing a crisis, please call one of the following toll-free numbers for immediate assistance.